much for joining us today for one of our weekly Fortune 500 focused webinars here. My name is Sam, and I will be moderating this presentation along with you today. In just a minute, we're going to be joined by one of our senior financial advisors. His name is Michael Corgiat. Michael is going to be discussing some things related to open enrollment, which is quickly approaching for the year of 2024. He'll also go over some of your healthcare options after retiring from your company, as well as some Medicare tips and things like that to help you out. Before Michael comes on, I'd like to just very quickly remind you we are not affiliated nor endorsed whatsoever by any specific company. We are a completely independent group of financial advisors here, so please keep that in mind as you're listening along. Throughout the presentation, I will be entering some links into the chat. Please keep an eye on that. They will guide you to several different resources we have available for you, one of which is our calendar link where you can book an appointment with Michael Corgiat or one of our other financial advisors if you wish after this presentation is ended. Another is our retirement guide and our complimentary cash flow analysis, which Michael will go more into depth with you about throughout his presentation. If you stick around after his presentation, he'll answer a couple questions. These are some of the more popular questions we've received lately. We like to answer as many as we can. We can't always get to all of them, but what he cannot answer live, I will make sure another financial advisor addresses with you either through an email or on the phone after the presentation. And with all of that, let's now get right into the content with Michael Corgiat.
Thanks, Sam, and thank everyone for joining us today. I know I appreciate it a lot. Today we're going to talk about healthcare costs and Medicare specifically, and then offer you an opportunity to take advantage of a service that we're happy to provide, our retirement cash flow analysis. It's complimentary, and we'd be happy to put one together and integrate overall long-term healthcare costs into your retirement plan. Two of the biggest concerns anyone has going into retirement. Number one, am I going to run out of money in retirement? Okay. A lot of retirees are living 25, 30, 35 years into retirement. And if they don't plan properly, they could potentially run out of money. There is a real benefit of putting a plan together. And secondly, the increased healthcare costs. It has gotten so significant. Overall, we're living longer, costs are going up, overall inflation has gotten out of hand, and other financial pressures really make this a significant fear going into and through retirement. So let's talk about healthcare costs. We'll touch on open enrollment ideas, some expected costs all the way through retirement, alternatives before age 65, and then health insurance and Medicare supplemental and Medicare Advantage after 65. Some open enrollment tips. I do work with a lot of corporate employees like yourself. I do ask them to come to me when it is open enrollment time. I understand medical, dental, and vision programs, life and disability and programs, healthcare savings accounts or HSAs, and then evaluating your overall retirement savings. You want to compare the options. There's more than likely 3 or 4 different options available to you with an associated cost. Most employers will offer you additional life insurance as well as additional disability insurance benefits. You want to keep an eye out for those, especially if you still have a family. Taking advantage of an HSA or possibly an FSA. That's a flexible spending account. HSAs are what I like to call the healthcare IRA. A family can contribute more than $7,000 a year to an HSA on a pre-tax basis. It grows tax deferred, and if you use the money for any healthcare expense today, 5 years from now, or 25 years from now, it does not cost you anything, and there is no tax on the growth. In other words, it's a tax-free benefit. Evaluating your retirement savings plan. We have entire presentations devoted to both pensions and 401ks, but certainly it is something that we would happy to be to talk to you about if you give us that opportunity. And then learning about extra coverages, or I like to call these the AFLAC plans, cancer programs, so on and so forth. Some employers offer these types of programs, and for some of you, it might make sense. The open enrollment checklists, or just a summary of what I've just talked about, starting with your health insurance, taking advantage of those savings and spending accounts, definitely. Does dental and vision, do you need it? What's it cost? Does it make sense? Again, life insurance. Most employers provide some. They usually give you an opportunity to buy more at group term life rates, which are fairly inexpensive. So should you consider it? Disability insurance, again, retirement savings, and making sure you've got your beneficiary designations up to date, especially for your life insurance. I know people who have actually gotten divorced and forgot to make a change and then wound up passing away, and their benefits went to the person that they really didn't want them to go to. So it does happen. Keep those beneficiary designations up to date. What is my retirement health care going to cost? Well, most people believe it's a lot less than it really is. The average American thinks it's $41,000. It's more like $315,000 over the lifetime of a couple at age 65. $315,000. That's in premiums and out-of-pocket expenses, co-payments, deductibles, and so on and so forth. And those are increasing at a pretty significant clip, 5% over last year. Healthcare costs have risen consistently well above the average long-term inflation rates, even the inflation rates that we've had to deal with here recently in the last couple of years. And the primary motivator for those healthcare costs rising so much and so quickly are prescription drugs. Prescription drugs have skyrocketed. Now, granted, generic drugs are a lot less expensive, and especially if they work, you want to make sure your doctors prescribe those sorts of drugs because your out-of-pocket costs are less. Any of the prescription drugs you see advertised on television are what we like to call non-preferred brand name drugs, which are the most expensive. You want to shop around your prescription drug programs, look at things like GoodRx, pharmacy benefit managers, which we call mail order programs, to limit your out-of-pocket expenses for prescription drugs. But bottom line, they are one of the main reasons that our overall healthcare premiums have skyrocketed over the last 15, 20, 25 years. Some of the alternatives that you might want to consider prior to age 65, if you were to leave your employer. Now, in many cases, you have a company retiree health insurance program. In other words, you work with the company so long that they will provide you with a healthcare program for you and your spouse in retirement prior to age 65. Now, that's changing a lot with a number of employers. There are employers that are raising the overall cost out of pocket. It's usually subsidized by your former employer. They're eliminating those programs altogether. In the case of AT&T, which is one of the companies we do a lot of work with. So if that's an option, you definitely want to investigate it because those premiums are typically subsidized. If you do leave, your spouse is still working, you might want to consider joining his or her plan. It certainly will probably cost the two of you something, but it will be a lot less than going out and trying to find something on your own. Go to work for someone else. Hopefully they offer a good healthcare program at a subsidized rate, and that's always an option. And then finally, the ACA, the Affordable Care Act, or the healthcare exchanges. This is definitely an option that's available to all of us, all right? And one of the there's several benefits, all right? The marketplace does offer upwards of 87% of the individuals that apply discounted rates if they qualify. In other words, the regular premium might be $300 or $400 a month, but they have financial incentives that could lower the premium to you based on your income levels. 87%. You cannot be denied, and you cannot be limited for pre-existing conditions. You go right into these programs, and you don't have to worry about something that you're currently being treated for being limited or not or excluded altogether. There are no limits on pre-existing conditions. Definitely could get some reasonable premiums, especially if your income level is at or below certain different income levels. The government will subsidize the overall cost of that program. And there's a number of different options available. The old metal tiers, we like to call them, bronze, silver, gold, and platinum. Obviously, the lesser metal is going to be the higher deductible programs and lesser out-of-pocket premiums, going up from silver, then to gold, and then to platinum. I've talked about this a bit already, but running a cash flow analysis. Let us put together a retirement cash flow for you. It'll give you a better idea of where you stand currently. We can uncover potential red flags in your current retirement plan. The sooner you start planning, the better off you're going to be. We can plan for healthcare costs in retirement. We could factor those costs in, and we could also help you to identify various tax advantage savings programs that you might not be taking advantage of, as well as discussing all of your estate planning options, whether you have a trust or a will, whether it's up to date, these sorts of things, the dating of your property, the titling of things, so on and so forth. Medicare, at age 65, you will now be eligible for Medicare. And this is the federal insurance program. There's a range of programs and there is a range of premiums. Lots of alternate benefit programs I'll talk about here a little bit in the middle, but you're guaranteed that 80% of your overall medical expenses are going to be covered by Medicare, subject to a deductible of about $1,600 and change this year. Enrollment periods usually begin 3 months prior to your eligibility date and go on 3 months after that eligibility date. So let's dive into some ideas here. There are two basic Medicare sorts of insurance. There's Medigap or Medicare supplemental insurance programs. These are insurance programs that supplement the government-run Medicare program. All right. They typically cost more because they're true insurance. They don't limit your access to doctors and hospitals like Medicare Advantage plans, or what they like to call Part C. Medicare Advantage programs, first and foremost, you forfeit your original Medicare. This becomes your Medicare insurance. You are limited to their networks of doctors and hospitals. Now, many of these plans have great networks, but they're not all encompassing networks. In a Medicare supplemental insurance plan, if a doctor or a hospital accepts Medicare, your supplemental insurance will also be accepted. Premiums are lower on Medicare Advantage plans than they are on supplemental or Medigap plans, but you might need referrals to specialists. They do offer other benefits that you normally wouldn't find on a Medigap program, like vision and dental might already be included, emergency services, and so on. But keep in mind, if you go down the Advantage route and you become disenchanted with the Medicare Advantage programs, and you want to consider going back to a Medigap or a supplemental plan, you will have to go through medical underwriting. That is something that a lot of people do not or are not aware of. And many insurance salesmen out there do not tell you that. So when you get to that point, make sure you talk to your financial advisor about what makes the most sense to you. High income earners. There are certain what we call IRMA, income related monthly adjustment amounts. In other words, married couple earning less than $206,000 or an individual less than $103,000, their Medicare Part B insurance premiums will not be more than this year, which is $174.70 a month. Last year, I think it was $164.90 a month. That's your Part B insurance premium that you do have to pay the government for Medicare, regardless of whether you have a Medigap or an Advantage program. Now, if your income levels are higher than that, then your Part B and possibly Part D insurance premiums will be higher. Give me a minute and I'll show you that here in a second. But here we've got Bob and Jane. Bob's 65. He has chosen to take a Medicare supplemental insurance program. His out-of-pocket premium is $127 a month for Part G or a Plan G and a prescription drug program, which is Part D. His wife, Jane, who's still working, goes out and gets a healthcare program, whether it's through the ACA, but her premium is $1,200 a month. So this is how this couple could be covered. After, let's say, Bob was the primary breadwinner and Jane was a stay-at-home wife. I talked about IRMA. As you can see here by the table, if your adjusted gross income goes up from those levels that I talked about, 103 or 206, you could see the premiums that I quoted are going to go up as well. And they can go up significantly. Now, there are options for this to be reviewed by Medicare and in many cases can be adjusted. I have high earning clients who go into retirement who have IRMA issues, but they do appeal and they have been granted an exception because it was while they were still being employed. These issues do affect passive income on your, as far as your adjusted gross income is. So you have to do some planning if you've done a good job of saving for your overall retirement. Some premiums overall in the country. I mean, different parts of the country are more or less expensive. The average cost per month is $584 a month. As you can see here, some are higher, some are lower. All right. I'm here in Missouri. It's about average here in Missouri. The East Coast and the West Coast are typically more expensive, but that doesn't mean, you know, the state of Illinois or the state of Mississippi might be higher as well. So keeping in mind, it's not the same premium for each state across the United States. And the insurance companies vary state by state as well. Part A, I mentioned the deductible is $1,632 annualized, daily hospital co-payments, and so on and so forth. A good Medicare supplemental program or a Medicare Advantage plan will cover either all of these or most of these, some of these in this case, just depending on which plan you choose to go with. And finally, you know, we've talked about a lot of things here, medical insurance, the overall cost, the different types of Medicare supplemental versus Advantage programs. What are your options prior to age 65? You know, really give us an opportunity to talk more about this, as I'm really passionate about this. I've been doing this a long time, very knowledgeable on this subject. Why would you want to consider the retirement group? We're a team of advisors with lots of experience. We've got offices nationwide. We've got a great deal of knowledge on your company-specific programs. And again, we'll offer you a complimentary retirement cash flow analysis. You could scan this QR code here on down at the bottom of the page to follow us on our LinkedIn page, where you can also get future webinar schedules. Scan the QR code here on the left, schedule an appointment with myself or one of my colleagues. Again, follow us on the LinkedIn page on the right. And with all that, I'm going to go ahead and hand the meeting back to Sam, see what kind of questions, if we got any.
Thank you, Michael. Yeah, we got a couple great questions. This first one is really interesting to me. Will the company provided life insurance I currently have continue into retirement? And if so, at what cost and coverage level? Are there any conversion or portability options for my life insurance if it does not continue? It's long-winded, but good question.
It's a good question.
Yeah.
What Sam's basically said, somebody asked, I get employer paid health life insurance now.
Mhm.
Will it continue into my retirement? In most cases, most employers, not all employers, will continue to provide some sort of life insurance, like one-time salary.
Mhm.
Now, if you were paying for 5 more times salary, you could take that with you and continue to pay for that in retirement.
Mhm.
Your employer may limit that life insurance benefit. They may cut that benefit back because it does cost them money as well. I think they also mentioned, if they don't offer a continuation, can I convert it?
Right.
Well, this life insurance is typically provided by someone like MetLife or Prudential, okay, just to name a couple. And yes, those carriers almost always offer you a conversion option to some sort of permanent insurance without having to provide insurability. In other words, if your health is questionable, you still will be able to convert it and take it with you for the rest of your lifetime.
Wow.
It all depends. You'll want to check with your HR department.
Okay. All right. Wow, that's good. All right. Second one. I have an HSA for my high deductible health plan. Can I continue to contribute to that HSA after retirement, or will I be limited once I'm on Medicare or a retiree plan?
Great questions. First, I want to say, great. I'm glad to hear you have an HSA and you're contributing to it. You should put as much money into this program as you possibly can, because you can take it into retirement. And that's what I consider it, a healthcare IRA. Now, once you retire, can you continue to contribute to it? No. You have to be working, actively employed to continue to contribute to it. A lot of your Medicare out-of-pocket expenses can be paid for by your HSA, including Medicare premiums. Okay. So you just want to pick and choose what expenses that you want to apply
Mhm.
towards your HSA. But I certainly hope that helped answer that question for that individual.
As a follow-up to that, Michael, how should one best utilize the funds in their HSA during retirement for medical expenses?
Well, I mean, I like to say first and foremost, people shouldn't use their HSA while they're still employed.
Mm.
And I know a lot of people that do. All
Mhm.
right. I personally have had one for years and I have never used it. I'm contributing to it to when I get older, when I'm going to need it, when my income's probably going to be less and I'm retired, first and foremost. I mean, it depends. Okay. The little bills, if you could pay for those out of your own pocket, you should go ahead and do that. But I'd save it for the bigger bills,
Mhm.
like a one-time deductible for some sort of procedure that you've just had. Keeping in mind that this is a limited bucket of money. And as I showed earlier, overall expenses exceed $315,000 for a married couple. So, you're going to want to be careful and invest your money correctly to what you choose, pick and choose to have what expenses to be paid for.
All righty. Thank you. Yeah, that's a good tip. All right, we're going to do one more before we end today. Last one. If my spouse is younger than me and not eligible for Medicare yet, can they remain on my retiree health plan until they qualify?
It's another great question. And the answer is maybe. Okay. Again, a lot of employers want to use it 65 years of age and you're going on Medicare,
Mhm.
or you've got retiree medical and then you turn 65. Okay. Many of those plans do allow you to continue to cover your spouse if they're not 65 years of age yet. Many of those plans do. I can't say, the premiums are more than likely to gonna grow year after year.
Mhm.
I personally benefited from that because my fiance is over 65 and is on Medicare. I'm under 65 and I was able to continue on her healthcare program through her former employer. So the answer, I mean, it benefited me. I can't say it's going to benefit everyone. Again, check with your human resources department. For in the most part, in most cases, if you've got retiree medical, you will be able to continue to cover your spouse. Retirement medical overall is costing corporations a lot of money, and they're beginning to limit and eliminate those benefits.
Yeah.
So keep that all in mind.
Right. All righty. All righty, Michael. That was it. That was all we have time for today. I wanted
Great.
to thank you for all of your expertise and your advice here, and we want to thank you all for joining us. We hope we see you on another webinar again very soon. Have a
Thank
good day,
you,
everyone.
everyone.
Thank you. Thanks, Michael.
Thank you, everyone. Have a great day.
Bye.